And I can see Amy sitting there going, he's just mad.
And I love him. Yeah.
You're all right.
Right. Welcome everybody out in the community, and welcome to the people in the room here at the Pyrenees Shire Council offices. This is our forum on online kids forum about vaccinations. Very much welcome everybody today to the forum, and I'd like to begin with an acknowledgement to country. I'd like to ask Uncle David Copley, please, if he would do a welcome to country for us.
Thanks, David. And I'll do that in the language of my people from South Australia. Nina Mani, Nayacho Yakandalia, Nayacho Yangandalia, Nainari David Tanda Copley, Yachana Gana, Naiwangandi Mani Nabudna, First Nations Yurta. Translated basically what I said. Hi, everybody. How are you, my brothers and sisters? My name is David Copley. My Aboriginal name is Tanda, which means red kangaroo. I'm an elder from the land of the Kaurna people. I'd like to welcome you all here tonight and acknowledge all of our ancestors and our leaders, past, present, and emerging, from all the First Nations countries that this YouTube might cover. Thank you.
Thank you very much, David. Much appreciated. This forum is an opportunity to hear from both medical experts and ordinary families in the Pyrenees Shire and surrounds about our COVID journey around vaccines. And I use the word journey very advisedly because normally when we pack the kids up and we put them in the car, we can tell them where we're going. This certainly COVID journey has been one where we actually are in the car and we're going, but how the destination has been pretty unclear, although it's certainly we're getting in a process where it's getting clearer in that sense. And in that context, when it is a little unclear, like where are we going, Mum? And are we there yet? The questions that we're going to deal with tonight are very much about how we get there safely and how we get there together. Effectively, I would like, just to begin the process, I'd like to thank the Victorian Government for the support for this, and we have a couple of officials from the Department of Health who I'll introduce in a minute who are here to support us as well in a technical sense, which is terrific. We have a number of questions. We've done a little bit of workshopping among us already, but you're very welcome to submit questions through the YouTube channel, through the YouTube chat function, and by all means, ask questions of the panel during the process, please. The purpose tonight is to share experiences, both as parents and as people in the medical field, and understand, I suppose, that your journey at home probably is not much different to most of us in the context. And the questions that you have probably been the questions that we've had as well in that sense. What I'd like to do now is just introduce our panellists, and I'll bounce a little bit. We've got 3 panellists on screen and 5 panellists here in the room with us, which is terrific. And if I could just ask each just to quickly say a little bit about themselves and where they come from. And Rendell, could I start with you, please?
Yes, certainly. So my name's Rendell Wiseman. I come from Maryborough District Health Service and I'm the pharmacist there. So my role in terms of the vaccination has been getting supply of vaccine. I've also been working in the vaccine clinic, vaccinating people and helping out with the drawing up of the vaccine as well.
Fantastic. Lovely to have you with us, Rendell. Thank you very much. Now, we've already heard a couple of words from David, so we've got a little bit of a sense of David. But David, can you give us, please, a little bit more of a sense of yourself, please?
Okay, well, just start with, I'm obviously Aboriginal. Well, maybe not so obvious, but I am. I'm a registered nurse, mental health nurse, developmental educator. I currently work as an academic advisor at La Trobe University. But for this forum and for the people out there on YouTube, apart from a vaccination advocate, I've also had a lot of experience as a senior consultant at the Women's and Children's in Adelaide, and I think that might be the part I probably bring to this. And also in community health. I've worked in regional community health for a long time.
Thank you, David. It's fantastic to have you with us. Ange, can you tell us a little bit about yourself, please?
Yes, sure, David. So I'm Angela Chandler. My husband Tim and I run a business called Cave Hill Creek, which hosts school camps and holiday camps. So I suppose in some ways I'm interested in this topic from two perspectives, both from a business but also as a parent. And we have 5 kids aged 11 to 16. So we'll talk a bit more about that journey with you today.
Thank you very much, Ange. Amy Price.
Thank you. So I'm Amy Price. I'm from the Engagement and Partnerships team at the Department of Health. Our team work to support access to the COVID-19 vaccine across Victoria, acknowledging that some barriers do exist in the community and working to address these. Also working to reduce misinformation and assist the community to basically make informed decisions around the vaccine.
Thank you very much, Amy. Delphine.
Thanks, David. Yes, my name is Delphine Barber. I'm the early childhood teacher at Avoca Preschool. So I teach the 3-year-old group and the 4-year-old group. I'm also a parent of 4 children. So a 12-year-old, a 15-year-old, a 17-year-old, and a freshly turned 18-year-old.
Great fun. You and I will have a couple of things to talk about later, I reckon.
Yes.
Thank you very much, Delphine. Eliza?
Hi everybody, so I'm Eliza Gales, I'm from the Department of Health as well, and I work with Amy in the Engagements and Partnerships team, and I think Amy's summarised our role within the COVID response A+, so there's not much more I can really add to that.
Great to have you here as a team. Thank you very much. Christina.
Thanks, David. I'm a nurse immuniser, but I'm also a quick care registered nurse, and I work both at Beaufort and Skipton Health Service and Ballarat Health Service. I'm what you call the Grampians sub-hub coordinator, and that's because of the Grampians Public Health have got sub-hubs throughout the region. So I'm immunising all our staff, our residents. I've even immunised my adult sons and their wives, and my grandchildren can't wait to be immunised. So this is very current for me.
And very close. Thank you very much, Christina. Tanya.
Thank you, David. So I'm Councillor Tanya Keogh, one of the councillors here at the Pyrenees Shire, and so have been involved in the community information and supporting our community through this COVID time and supporting people with vaccinations. But particularly more personally for me, I've got 7 children aged from 13 down to 7 months. So that's been a very amazing journey at this time to have those different ages. So it's very exciting tonight to be able to talk about it and to look into this issue more.
Thanks very much, Tanya. And of course, I'm David Clark. I'm also one of the councillors here at Pyrenees Shire as well. And I've got one who's too young to be vaccinated and 2 teenagers who are vaccinated, which is really good. Rightio. As I said before, I've used the word journey really deliberately because I think that really kind of encapsulates where we are in that sense of things. And I'd like to begin by going around the panel and getting each of you to kind of explain in simple terms the vaccination journey for your family in that context of things. And rather than me pick somebody, who would like to start?
I'm happy to jump back in, seeing I was last. But I guess as a councillor, again, I just alluded to the fact that being involved with a lot of members of our community and from various age groups, I felt for me personally, it was really important to protect myself, but even more so to protect others and those that are vulnerable in the community. The same with my children. So my children are engaging with elderly family. We've just had a newborn baby this year too, which was again a heightened awareness to how we can protect the particularly vulnerable state that little Grace was in. So my eldest Annie, who's 13, she is double vaccinated with Pfizer and had no worries there. Had some swelling and the normal vaccination reactions, but that was really a non-event for her, and she was very happy to get that. And I have a 12-year-old who's waiting, so Tom's ready in January. So for us, again, you know, it's about protecting ourselves, but even more so to be able to protect as a community those that are most vulnerable through being able to be people that can be vaccinated, to take that opportunity. Is anyone who would like to jump in next?
Does anyone else jump in?
I guess I can talk a little bit, it's probably along the similar lines with my job at the preschool. working with very young children, just wanting to protect them. That was the initial reasoning, and just to be in the profession to have that done and maintain my job as well. But then also it was the decision then about my children, and initially that was a little bit daunting, because I think when you're making the decision for yourself, it's very easy as a decision about yourself. But when it comes to making that about your little people that you spend a lot of time worrying about and that sort of thing, that was a little bit different. But once you sort of, understand it a little bit more and have lots of discussions, lots of family discussions about what was happening in the community, what was our duty of care to the community as members. My two oldest have part-time jobs, so as well as going to school, they were in hospitality, so they also were coming in contact with a lot of people. And then also discussions around the older, their grandparents in our family were still wanting to see them, especially after lockdowns and things like that. So it kind of become a journey, really. Initially, the older two children we're just like, yep, that's fine. And then my 15-year-old boy, who's 6 foot tall now, just about 6 foot tall, said, no, Mum, I don't want to have it. And I realised then that we needed to have lots of discussions and continue that discussion, because I couldn't drag a 6 foot tall boy in to get his immunisation. So with lots of family discussions and lots of talking to our doctor and health professionals and things like that, we were able to all become vaccinated. So
thanks, Delphine. It's terrific.
I'm happy to jump in now, David. I mean, our experience has been a positive one, I suppose, with the vaccination journey. Our business was quite severely impacted, I suppose, with COVID. So there were a lot of factors in both Tim and I jumping in very quickly and getting vaccinated. But one was, we employ a lot of staff, so having them see us as, an example and providing a safe workplace for them. They're wanting to protect our children and our extended family, and a lot of those same points that have been raised. I think our kids also felt, therefore, having seen the impact on our livelihood and business, and the significant impact it's had on their education and curtailed their sports and, all of their social interactions with their peers, their education, all of those things, they just wanted it to get back to normality. So for them, especially our eldest, who's going into year 11, it was, she just wanted it as soon as she could get it. Our eldest also has a chronic medical condition, so was very keen to get it at that early stage before it was allowed for over 16s, and she was actually very prepared to take whatever she could get. There was no issue about whether it was Pfizer or Astra or whatever. It was just, no, I just want to be vaccinated. She wanted to make sure that she was as protected as she could be. She knows she can be susceptible to things. So that was just, the first thing on her mind was that she wanted to go and do that. So that was really, really positive. I think then the other kids, we've got 3 others that are now vaccinated, and they just wanted to do it as soon as it became available. My oldest just sort of said, I just want to go back to some level of normality. And gave the example the other day of him going to the DFO and feeling like he could actually go there and shop and feel a little bit protected himself. One of our boys had a reaction where they were a bit nauseous afterwards and were a bit sick during the night with a temperature, but that seemed to settle and go away. And I have to admit, he sort of shrugged it off and just said, well, it's just what we have to do. So he bore that. And our youngest, who's 11, keeps asking when she can have hers. So I think, that they, after and lots of discussion, that they really feel like it's the right thing to do, and so that they can get on with their lives as well.
Yeah, that's a really good point. And that's very much in our case the same thing. Like the kids, I think, have missed out more than anyone in the things that they're used to, and being able to get back and do those things have been a terrific motivator to help them.
I've got 2 children myself, so they're 2 and 4, so they're obviously not even being considered to be vaccinated at the moment. So for my personal reasons to get vaccinated was to protect them. Like working in a health organisation, you don't want to be bringing anything home and hurting your kids. So that was a big determinator for me to get vaccinated. But I've also seen the other side of it and the questions that sort of get asked in the vaccination clinic and the concerns, and it's been very interesting to be involved in that side of things as well.
Yeah. Thanks, Rendell. Now, Christina and David, I know you've both got a bit of a deeper perspective in terms of grandkids as well. Which of you would kind of like to lead off next?
Happy to chat. I think I'm biased. I've been immunising for over 16 years. I'm very biased. I'm a pro-vaccination, but it all has to be done in context. And it's great that the community is coming along on this journey and wanting something that we can provide the service for. I have done quite a few disabled persons and younger persons, and when the VCE children needed to come forward, they were very keen. They knew what, and they're very researched about things, and they knew their facts and they knew what they wanted, and don't hold them back. But I have grandchildren as well who cannot be vaccinated, and I have 5 in total, and they are a concern to me. So if myself and my adult sons, their fathers are vaccinated, we're protecting them all as best we can. And they're looking to us as lead adults to say, well, if you're doing it and you think it's a good idea for you, we'll follow suit. So we're setting an example. The grown-ups really have to arm themselves, pun there, but really we are leading by example, and our dialogue reflects that. Their concerns are valid, but look, I went and had it done, so-and-so's had it done, and they experienced that. So majority of that is a positive experience.
Yeah, very well said, Christina. Very well said. David?
I think mine's very similar. I mean, everybody in my family who can be vaccinated has been. And I think we're just waiting for when we get to a point with this vaccine, the same as with the flu vaccine, and everybody from 6 months up will have it. And that's our thing. I think I kind of have a double string. It's apart from, and I've been asked lots of questions by family members, and we've gone through lots of things, you know, I've got this, I've got that, can I have it? And I say, well, the first thing I say is, what did your doctor say? Doctor said I can have it. Well, then it's not an issue. But the other thing is, because I'm a community elder, then I'm also working in that space with older people who are a bit worried about their chronic health conditions, right down to, you know, to mums and dads with young babies. So it really is a journey, and it's one we have to, communication needs to be spot on between families and community.
Thanks, David.
And I think as a nurse, I've also done the same thing, and I work with disabled groups and Indigenous groups and a whole range of things. And in one of the forums we had a couple of weeks ago, how not having the vaccination has impacted. We had the South Pacific family, and one family had mum and dad during lockdown and 14 children under the same roof. You know, so there's a whole lot of other issues about, yeah, we want to get vaccinated as soon as it's out there.
Yes. Thank you. All right. I think what we might do is deal with some of the, I suppose, the technical, what I call the technical issues around the vaccine. I mean, vaccination is completely usual to all of us. We were all vaccinated as kids, and we've all been on that journey with our own children in the normal vaccinations that we have in that sense. But there's probably 2 things that strike me that's really been different about this one. First one, obviously, is the speed with which the vaccine's been able to be delivered. And that's a lot about resourcing. But I think the second thing is about access to information, and not necessarily great information. And I'd like to go to the panel and see if you could give me a bit of information around those 2 issues particularly. And David, I'm guessing, would you like to start in terms of that? That'd be great.
If I can. So, I mean, the first thing is people go, well, this was developed very quickly, and so is it safe? So let's backtrack a little bit and say, you have a flu injection every year. That is redeveloped every year. So basically what happens in the Northern Hemisphere, the guys, the company that's producing this vaccination also produces our influenza vaccination in Melbourne. And they're going, that's what they've got in the Northern Hemisphere. We will develop it so we have that for our winter. and it's redeveloped every year. So the whole thing is we have the technology and we have the science to do this quickly and to make it safe quickly. We're not going back to, I mean, in the Spanish influenza of 1918-19, the same company who's developing the AstraZeneca here in Melbourne developed a vaccine in 1919. Now, because their technology was a bit ancient compared to what we have now, they actually asked for volunteers to test their experimental vaccine. So we're well ahead of that, and it is safe. And we produced a new vaccine for influenza every year. So it's not a new gig from the development point of view. What was the other question, David? I'm sorry.
So the second bit is really a bit about the information flow in the context, and the amount of information I think that's around.
And look, it hasn't, in the early days of the pandemic, it was bad. And when we started with vaccination, it wasn't good because we had health officials saying one thing, politicians saying one thing, the media, everybody has to be over 60 to have AstraZeneca. Then they can be from 50 up. Now anybody can. It was very confusing for people because there was no straight down the line, we'd use this for this, we're going to use this. It was all over the shop. And I think that confused people. And as I was saying to a few of the people here the other night when we were having a chat, I stopped in at the shop between Bendigo and Mildura a couple of weeks ago, and we were just talking, and the lady behind the counter said, well, I've had one shot, but I'm not having any more, and my teenage kids aren't having it either. And when we had the conversation, and I don't even know how the conversation started, but when we had the conversation, it was because she wasn't getting clear information from her health professional. She'd had a swollen red arm and thought that was a really bad side effect, so I won't give it to the kids. So when we sat for about 20 minutes and chatted about the whole thing, she went, well, that's the first time I've heard all about that stuff. I'll have the second shot and the kids can go along as well now. So the information is critical, and it's critical to put it out there in a very plain, everyday language, not all the scientific mumbo jumbo that we can do.
Yeah. And David, I think you hit on the head. The challenge of the changing rules just make it difficult. That's just an absolute reality. Do others want to comment on that particularly?
Yeah, I'd like to comment on that because the media has put out so much, and it's a lovely sensational headline, and people were, it was all over it, and it was too muchness. People were actually, I think, and David may concur, mentally getting harmed by so much of this sensational headline stuff. But I think it's overload. It's calmed down a little bit more. But globally, there were so many people working on this vaccine. It wasn't like just these people doing it at this rate. Every nation was working on it, and great momentum. If only we could do that in other areas. But millions of people and millions have had this vaccine. So our knowledge about side effects is exponentially, even if it's a 0.5% of people are getting it. We learn this, and our technology is transmitting it quickly. So we know almost real time what's happening in other countries, which is phenomenal. This is very different because of the volume, the people working on it, and the sheer numbers that are being vaccinated. And we're learning from all that information. So there are adjustments.
And that's what we do with the influenza every year. We look at the Northern Hemisphere in real time and go, that's what we're going to use here in the autumn.
Yes.
And it's not just one lab working on it. There's just so much.
And we've probably been fairly lucky in Australia too, because we held back our rollout was probably a bit behind the rest of the world. So we were able to get everyone's information to make the right decisions for all Australians. So we've got a very robust sort of system to make sure that these vaccines are safe.
And I think, as you say, Rendell, there's a really robust system anyway, but the fact that we've got such good real-time information has been the absolute bone. Like, there's been too much information in some ways on the understanding it, and there's 2 cases over here that have had a negative reaction, and there's 3 cases in another country. Does that mean the thing's bad? Well, no, it doesn't when 5 million people have been vaccinated. But the real-time information on the other side in terms of our actual capacity to adjust and amend, as you say, has been amazing, hasn't it?
Yeah, and the other side of it too, like you've got Ataji so with some of the vaccines, like with the heart complications, they get cardiologists in to discuss the risks, the pros and cons, I guess, of the vaccine, what's going to be worse. So like, it's not just people that are invested in vaccines, you've got all experts that are involved.
Yeah, and I think that's the big thing there through with the target is, okay, you get one person in a million who has a heart condition that may last 10 days. You know, they get some fluid or whatever. But how does that compare to that age group who get COVID and wind up with a heart condition for 20 years? That's the information that Atagi and a lot of health professionals are working on. And I think the interesting thing is around the media, since the states have stopped having their daily, pandemic expose, the media is struggling to find stories at the moment. The news of the day is pretty bland because they've lost all their sensationalism. So it's interesting that they've really dropped off everything they're talking about now.
Yeah, that's a really good point, David. As you say, we've gone back to getting the other news that we used to get 2 years ago and finding out about the sport and that. Yeah. Ange and Delvin, you've both got employees in that context.
Yeah. And I think that's a big thing.
Yeah, I think that's right. Is there anything you can relate to us about that experience, particularly in that conversation and that wealth of information that's been around, not necessarily good information in the context of the conversations you've been having?
Look, I suppose I'm constantly amazed at, how uninformed people are. And that goes back to that information, even being able to reassure my staff that they could have a vaccination, every 3 weeks now is, some people still think they have to wait 6 weeks. So it's been, how you keep relaying that information to them and reassuring. And I mean, look, we just encourage, we've been supportive and we keep opening the door to, the staff team to work with. I mean, given that we work with kids and that we also work in hospitality, there is a requirement now for us with our staff to be vaccinated. And so, we've very much just tried to lead by example and to keep feeding information through as we can to our staff team.
Yes, and I think I found being linked in with the education department, so we're getting lots of information from them. I found that quite informative, so I was able to do my own reading from what the education department was sending through, having lots of discussions and being very aware of the information as it was coming out. And I did find, dealing with other people in the community, parents, that some people had just shut off because, as what we talked about, it was just too much. And then other people found it was too rushed. They felt rushed, trying to make a decision, trying to, listen to all the information and then make their own decisions. They found that very difficult and just needed time to have those discussions and actually take in what the information was and the correct information and seeking that correct information from their doctors or healthcare providers rather than just their neighbour or that sort of thing. So I found that interesting and in discussing with parents, their decision making in relation to that, through friends as well. That seemed overwhelming for them, the information that was coming out. And I think being on the media everywhere, people were just shutting off everything, turning off TVs, turning off and then not talking. I had a co-worker come and I was talking to her, did you see this is happening now? She's like, no, I'm just not listening anymore. So that, combating that as well, I think for parents was hard.
That's very much the case, wasn't it? Very much the case. Now, I've got a couple of quite specific questions I'd like to ask around this. Now, the first one is, I'm just going to find it. Is the vaccine safe in kids that've got autoimmune conditions? And I'm kind of looking at either you, David, or maybe Rendell in the sense of that, or...
Well, can I jump in first, Rendell, if you like? Because Rendell and I see it from similar but slightly different perspectives in that I'm seeing it from a nursing perspective, and she's kind of seeing it from the pharmaceutical perspective, and we kind of probably get asked the same question a different way because they like to find out if we're both telling the truth. My first thing about that is, have you been to your health professional or your specialist, and what did they say? And if I say, well, no, I haven't done that yet, well, I'm going to say, well, you know, can't answer that question till you tell me what they've said. And that's the bottom line. If you've got an autoimmune deficiency, or you're a cancer patient, or you're a cardiac patient, or you've got lung disease, whatever it is, unless you've spoken to your specialist or health professional, then you're asking questions of me and Rendell that are kind of, we can have a guess, but it's out of our scope of practice, really.
And there is a better informed person, David. That's what you're saying, isn't it? There really is a better informed person that knows you as an individual. And
knows what drugs you're on. And I mean, as I said, Rendell might have a slightly different perspective of that, and they know what drugs you're on. Although sometimes, quite honestly, Rendell will know what drugs they're on as well. So that might give her a bit of relation to that.
Upper hand.
Yeah, you can't take that because you're taking 47 of these.
Yeah. So I'd probably have a very similar view to David, in that I'd probably get them to go to the GP and get a referral to a paediatrician who specialises in vaccinations in immunocompromised, just so that they are getting the right information.
Yep. Thank you.
Yeah, I could just add in there, David, that I do have a child with an autoimmune condition, and we just we took her in to see her doctor, who agreed wholeheartedly that he thought it was okay for her to have that, and we took her along and did that without a second thought. After that, it was just nice to have that reassurance for her.
I mean, I did the same with my specialist from my chemo and that, and I haven't had chemo for a long time. And I rang her up and I said, can I have this? And she said, get whatever vaccine you can have and get it now. So there was no mucking around, but I professional or not, I still felt the need to ask that question.
Thank you, David. Now, the second one I've got is coming from a member of the public. My son has just turned 12, but he only weighs 36 kilos. Would a full dose be too high for him?
I would be seeking, so what we're talking about at the moment, or what the authorities are looking at and reviewing with Moderna and Pfizer, is the dose for 6 to 12-year-olds. And it looks like that will be about a third dose. However, he's 12 with a low weight scale, could be a very tall kid as well. So that would be a call for a medical person to make. And it comes down to having worked in pediatrics. All pediatric medication quite often comes down to body weight.
Yes.
And it's moved around for body weight. So they may recommend a full dose, they may recommend a smaller dose, but it would be his treating physician to make that call.
Thank you, David.
Yeah, I'd definitely be referring to a GP to get vaccination in that regard.
Yeah. And that I assume, Rendell's been one of the key things about the process of working our way back through the age, particularly bringing in the 12s to 16s and then the 16 to 18s in that sense, is about getting that dose right and obviously changing that.
And you've got to look at kids too. Like, you can get really small 11-year-olds and then you can get 11-year-olds who are massive.
Yeah.
So, I think it's always good to get that expert advice.
Yes.
Yeah.
No,
that's right. My 2-year-old's the size of a 5-year-old, tall and broad, and I give him a full dose just to keep him quiet.
And in speaking to lots of parents in the community, that was the number one question that they had in when the immunisations come out for under 12s. Yeah, that was one of the main questions. How is it going to be adjusted? And so hopefully information flows through about that. Yeah.
And that's really important because ATAGI and the Therapeutic Goods Authority and all of these bodies working very closely with Moderna and Pfizer to make sure they get the dose right. And that's why it probably won't be, and Rendell, you can correct me here if I'm wrong, probably won't be approved and available till January, February next year.
Yeah, I honestly think they'll look at what's happening, particularly in America now that they've started vaccinating younger kids, and use all that information to work out what's going to happen here in Australia.
Yeah. So it won't be rushed into. It'll be a very slow, progressive, well looked at process.
Yes.
So parents shouldn't, when it comes on the market, I guess the bottom line is parents shouldn't be concerned because it'll go through a lot of rigorous stuff before it gets to the marketplace.
That's right. And as you say, if you look at America, Rendell, like there'll be many millions of children that will have been vaccinated before we actually vaccinate one.
Yeah, that's right.
In Australia. Yeah. That's right.
Just a comment on that. Right now, the message is it's safe, it's effective, it works, it's helping, all these people are being done. The reason you're delayed is because exactly that.
Yeah.
We know it works, we know you want it and all the rest, but we want to make sure you get the right dose. That's your reason for delay, not because we're retesting it or doing all sorts of things. We want to make sure it's the right dose. That's the current message right now for children. Okay, they're just making sure I get the right amount, the dosage right, because I'm a little person. Not that they need to look more at the vaccines, although there might even be more coming on board, but it's about that. And that's good messaging, I think.
And we saw that with like vaccinating like ladies that were pregnant, like they held back to make sure that they had all that information to make sure that it was safe before we were administering it.
Yeah.
Look, and we did this with the polio vaccine, and we did it with whooping cough, and we did it with diphtheria and TB, and all of these vaccines have all been looked at from a dose-specific view. The vaccine was good; they just had to work out how much to give to who.
Yes. Yeah. Thanks. That's very good. Christina, you made a comment before about the example that comes from you're doing it and your sons and your daughters-in-law doing it for the kids in that kind of sense. Can you give us a little bit of a sense about that discussions around the side effects and the potential side effects and managing that, and some of how you found those conversations have gone best?
I think it's important to talk about known side effects, and these are common side effects. As David had, the lady with the sore arm, this is common. It's a side effect. You've had a needle put in your arm. It might be sore the next couple of days. That's true. That's not a reaction. It's a side effect that we know about. You might feel tired, feeling a bit fatigued because your body's working on making up these antibodies against this terrible disease. You might even feel a bit joint aches and pains, but it's important. You're being vaccinated, and we're now going to rest and build up and look after our immune system, which wants to look after us. And these are known side effects. Some people even feel so tired they want to sleep more. Others might have a hint of insomnia and not be able to sleep. Their immune system is working on something it's never done before. And respect that and help it out. Don't go rushing around. And I had some young adults who wanted to do a footy grand final. And I says, well, how about I'll do you the week after? That way, if you're a bit tired, you'll be performing at your optimum. And then you don't have to worry about, oh, what if I've got a side effect or someone punches me in my sore arm or something? We'll do you after. The timing is important to fit into people's lifestyle because you will get side effects. Some people don't notice much. Some people get quite a few, feeling tired. Some people get a minor headache. But regardless of that, the risk of having the vaccine is what we're talking about versus the risk of catching wild COVID. And it's a risk-benefit thing. You will come in contact with COVID. You will. It's out there. It's in our current community as we speak here in Beaufort. I know that. And I also know there are people walking around the community that have COVID. Hate to tell you this, so you will come in contact. Let's be protected. Let's have our vaccination, our immune system working for us. It's
and it's
simple.
not, that's normal life, isn't it? We make decisions and choices like that every day.
And I think that's right, that we're, and look, the other side of a sore arm often comes down to how good the person giving the vaccination is as well. Because there's some out there who I wouldn't let touch me with a needle. You know, and you get a sore arm. So quite often comes down to that as well. But it's the risk of not having it's far greater than the risk of having, and that's why they make you sit for 15 minutes after your vaccination, because if anything serious is going to happen, you're going to have an anaphylaxis reaction or something, it's going to happen in that 15 minutes. In a very, very 1 in 2 million may get a blood clot a week later, but it's so small that it's, you know, you'll be struggling to find somebody who's had it. And I think we've had, what, 5 cases in the whole of Australia. So it's really, really minimal. But that's why you sit for 15 minutes, because if nothing happens, then you can go home, apart from a sore arm, you're going to be happy.
Yeah.
And then I think I saw that in our in our family discussions, sharing with the children the real documented fact-based side effects, not the side effects that people, well, what if this side effect happened? What if that? It was like the what ifs, even though they weren't. So we had to kind of have that discussion as a family and talk to the children about what these are actually the side effects. You know, these side effects that people are talking about are not even documented. They're something that someone's just worried about in the future. It's so I found that quite beneficial, especially with my teenagers, talking to them. You know, they're young adults and encouraging them to make their own decisions, but also, you know, getting all the right information
and putting a relativity to it, though, in this context of, you know, they're things you've probably already experienced. Right. You know, understand that they're not normal.
Yes, and I do think you have to say the teenagers seem to put it into very good perspective. We're worried about so much, you know, the weight of the world on us as adults. And I think my 17-year-old just said, well, I'd rather get sick, you know, with a side effect from the vaccination rather than get sick from COVID. And I went, oh, okay then.
And I think the other thing we've got to talk to people about, and it tends to be in people over 30, and they're the bane of every clinician on the planet. Please, people, stay away from Dr. Google.
Yes.
Because anything you Google about a medical condition will tell you you're going to die, even if it's a headache. You know, it always ends up with, this is fatal in X amount of people. You know, so teenagers tend not to do so much of that. They tend to do more peer stuff, but over 30s tend to go to Dr. Google and say, oh my God, I've got this, what's going to happen to me? You know, stay away from it.
Taking everything that you read on Facebook as gospel is another one.
Yeah, well, that's a whole different ball game.
Where you get your information from.
That's a deeper issue that Tanya and I have to deal with later in life as counsellors. I think in that sense, Other parents,
we have 2 boys in year 7 that had their year 7 immunisations at school not long before their COVID shots, and one of them just came home and said, "Well, that was no different after the COVID shot to my year 7 vaccinations. What was the fuss about?" Like I said, one of the boys had a side effect, and you know, dealt with that quite gracefully, but the other just sort of was like, well, that was no different to any other vaccination we've ever had to have, and the whole series that we have to go through our education and our schooling. So to put it in perspective for them, you know, that was just, you know, sort of a wilder fuss, and why was it so different?
I think
the adults are making more fuss over this than the kids.
The kids come through, don't they?
Absolutely. Adults are, you know, and adults who work in media are making the biggest fuss. But it's interesting when, and for some reason, we've got a over 25-year-old age group who are far more influenced by some parts of social media than teenagers. Teenagers are influenced by social media within their own peer groups, obviously, but outside of that, they don't seem to worry too much. And I was saying to a couple of you the other night, we had a thing on Facebook, which we got taken down, but it was by an Aboriginal health practitioner with quite a few hundred followers who was preaching that this was all a plot by the federal government to wipe out Aboriginal populations with vaccination. And I pointed out quite clearly that, well, they've shot themselves in the foot because they're giving it to the white fellas as well. So how does that work? You know, it kind of doesn't make sense. People stop listening to the rubbish. So yeah, we have to deal with that misinformation all the time. And I think that's really important, that we acknowledge there's a lot of it out there.
So that's a really good transition to another question I've got here. So because we're parents, we don't only deal with our own kids, we deal with other people's kids, our friends' kids and their friends and that kind of thing. And I've had it put to me that, you know, one of my kids has a friend who's 15 who wants to get vaccinated, but his parents don't want him to. What advice would you think is appropriate to help that child work that way through in that sense of things?
Well, I think the first thing from a nursing medical point of view is if that child wants a vaccination, the parents can't stop him or her. They can't do it because it's either, and it varies with some states, but it's either 12 or 14 here. Parents lose consent around teenagers' medical. In fact, the teenager can stop them having any information about their medical history at all. I'm not sure if it's 12 or 14 in Victoria. So if that child wants to, that adolescent person wants to go and have an injection, the parents can't do anything about it.
Well, that's very wise, yeah.
Yep.
Yeah, from an immuniser side of that child then fronts up. It is implied on the immuniser to check it is an informed consent.
Yes.
Just turning up isn't consent, although that's implied because they walked in and volunteering. But I'd be making sure that child understands the side effects of being vaccinated and what to watch out for and the reasoning behind being vaccinated or not. They've come, I'm thinking they're probably very informed, but I would be telling them, let's book you in a week's time. You need to keep your relationship with your parents, go and talk to them, explain this a bit further. There's also some medico-legal issue here because depending on where the immuniser is working at, the facility they're working under might not cover. If the parent has explicitly not wanted the child to be vaccinated and the child can't demonstrate that they are they used to call it emancipated minor, but they're legally competent and intelligent and comprehending, and they can demonstrate those to you that they're fully informed, they understand and all the rest of it. Technically you can, but are you covered? It's better to work with the relationship with the parents and get them to come in. They might not agree, but you need them on board because you also need to find out the what ifs. If the child has a problem, who's the next of kin to call? And that's the parent who didn't want them done. You really make it a tangle because we want the consent, ideally with a parent or guardian, and somebody, they need to know the what if, who's going to come and help you if you do have a problem. So you lay yourself a bit open. It's not like well, it is like it, but to keep the person safe is the important thing, and their household relationships need to keep going on.
Oh, yeah, I know.
Yeah. I would defer them. I'd say you can still be vaccinated. It's important that we get informed consent, and a week's not going to make much difference there. But rushing them in and jabbing them and send them home, look, I was vaccinated and you didn't want me to, you're really setting yourself up for bad PR as well as potentially legal ramifications if the parents are real anti-vaxxers.
Yes. Yeah, and as you say, a little bit of time here doesn't make a significant difference. A little bit of time to work this through is a really good advice.
Yeah.
And sometimes I think underneath people's parents' resistance for their children to be vaccinated is just a fear, and parents are scared. And I think if they've got more opportunities to have discussions with health professionals and their doctors, that they can alleviate some of that fear. I think, behind some of those, some decisions, not everybody's, but I just think time and discussion and sharing of information is really important.
I've had the reverse situation where a staff member brought their 12-year-old in to be vaccinated, the adult, the 14-year-old, so the older brother had been done. This one's now coming, they're eligible. And the child cringed away from me. And I'm like, if you don't want this, I'm not going to do this. But if you want it, I'm here to help you. And we had a good chat about this. They were just scared of needles.
Oh, yeah, that's a huge problem.
Witnessed their brother be done and their mother. They knew what was happening and they wanted it, but they didn't want it. So it's important to pull the pressure off and say, well, look, you could come back in another couple of days. I'm not going to hold you down and do this. You're an adult or you're grown up enough to make a decision about your body. And just that bit of dialogue about, I'm respecting you to make your own choices. They feel a bit empowered. Okay, well, it stings. It might sting a little bit. It's very short-lived, that sting. Okay, it's not going to hurt. Don't ever use the word hurt.
And I think that's important. We had that discussion at home as well, actually going through what would happen and what it would feel like. So if there are any parents listening who are, you know, going to take their children to get immunised, share your experience, share what it felt like and actually talk it through. So I do have one who was afraid of needles and I didn't realise. And once we talked it through and went through what actually was going to happen, how long we were going to wait, talked about the lollipop at the end. That was good too. So yeah,
I want the jelly bean.
We do the healthy eating option as well. We get a banana of that as well as you like.
it did help.
The lollipop is good for a 15-year-old.
It's not bad for us older fellas either, David.
No, that's exactly right, David.
But I think that's an interesting point about the fear of needles, and one we don't talk about a lot from either a parental aspect or a professional aspect. And I have an 18-year-old family member who has been petrified of needles all their lives and basically needs diazepam before they can go and have a vaccination. However, because of the known information they'd received and the knowledge about COVID, they bit the bullet and went and had the vaccination without the sedative, which was kind of an interesting outcome. But yeah, we don't talk about fear of needles and other things enough out in the open.
As you say, Delvin, like the conversation is really important. I mean, my 17-year-old, he was just a breeze, but I was really glad I was out with my 15-year-old daughter. She was, not that she wasn't going to do it, but it was, and you know, we went to the mass vaccination clinic in Ballarat. And if you haven't been to something like that, it's a pretty scary place for your first time around. It's just kind of all happening and there's lots of moving parts. There's people going everywhere. And am I really, you know, is someone actually really in control here a bit for me? And yeah, that was certainly my experience. Others have.
So that, I think too, David, I mean, my eldest raced into the Max Vaccination Centre by herself and she was quite happy. The other three we took to a small community clinic, which was a lovely, we went out to Elmhurst. It was a lovely environment. The kids were welcomed. They were chatted to nicely. They were sat and there was food afterwards. So I think, you know, sometimes you can choose too where you take them to make that experience as positive as possible for them.
And actually ours, Annie, who's the only one out of ours that's vaccinated, we went to the local GP, so that was totally knew the GP so well, and it was just absolutely a breeze. So it was really lovely. Yeah. And they were beautiful too. They were in there. And they actually had a group of teenagers at that stage doing it. And I think, again, looking at other teenagers and knowing that others are doing it at the same time, you're in it together. And I think through this whole journey, we're in it together. We've been put in it together, whether we like it or not. And it's just wonderful to be able to come together and do that as a community to protect others in the community, as well as protect ourselves from the severity of something which, you know, has posed such a fear factor, to be able to work together. And you know, even tonight being here together, I think it's wonderful to share in this journey together.
I think it's interesting about this because when we talk about mass vaccinations, and apart from school vaccinations, which aren't really mass vaccinations, they're just ongoing thing. But we haven't had a mass vaccination in this country for 2-3 generations. The last mass vaccination in this country was the poliomyelitis epidemic of the 50s. So we've got depends how old people are, 2 or 3 generations who have no idea what a mass vaccination even looks like. Because the last one was poliomyelitis.
Yeah.
You know, so that's a whole. So the communication we give needs to be really clear, and it needs to be. I mean, we talked about coming on here tonight. And we've got all these PowerPoints we could have put up and talked about, you know, the DNA of the vaccination and how it attaches to the virus and the whole thing. And it's a really cool PowerPoint demonstration, mind you. But I think it's more about what questions people actually have and dealing with those rather than telling them what we think they should do.
That's right.
And Brenda, do you have some numbers on how good the uptake's been in that 12 to 16 cohort, or even the kind of back up to the 18 cohort in terms of that take up number?
I don't actually have a number, but sort of from the bookings that we've had, as soon as they were available, we were booked out. Which was completely different to most of the other age groups. It was sort of, you wouldn't get much for a while, and then there'd be like a COVID outbreak, and then the phone would be going red hot again, and then it'd back off, and then another outbreak had come and it'd go bananas again. But yeah, as soon as the 16, particularly the 16 and up age group was eligible, our phone was off the hook.
Yeah. And we saw this in Melbourne as well. Amy or Eliza might have the data, but we saw this in Melbourne where it was the first day it was available, they were queuing up at midnight at the mass vaccination centres at 3 times the rate of the adult population.
My teenagers kind of reflected the view. I think they were looking at their future so much. The year 12s were wanting to get to exams and wanting to finish, you know, so they could, you know, go on and start their lives as they could, if they could communicate that. But they wanted to go and be interactive in the community. They wanted to go back to sport, especially in the rural area where we were. So they wanted to get back to football and netball and participate in community. And they wanted to go to parties, and they just could see the future. I think that was what was driving them rather than the outbreaks. It was the lockdowns, I think, and the lack of socialisation that was driving them.
And that was probably the big comments through the clinic as well. We just want to get back to normal.
Yes.
Yeah. Oh, absolutely. Can I just throw another curveball in here, because it's happened in rural, remote and metro areas. And I blame a lot of this on the media, sorry. No, I'm not really sorry, but I do blame a lot on the media, because we've had incidences in regional Victoria where an Aboriginal person's got COVID, and we've seen racism against Aboriginal people go up dramatically. And then we've seen Muslim communities in Shepparton and Melbourne. They brought the COVID in. It's all their fault. Send them back to where they came from. Hang on, they've been here for 4 generations. What are you talking about? And then we saw the Jewish community in Melbourne. And I think the one thing I want to put across here is that this virus has no racial discrimination at all. It doesn't care if you're pink, black, blue, yellow, fat, skinny, tall, short, or how old you are, or how wealthy or poor you are. You know, and we need to, that's another thing we need to be working on, that it's not coming from influential people or low socioeconomic communities or black or religious groups or whatever. It doesn't care.
And again, David, that's one of the really strong things where, you know, the privilege of being in the 21st century is the data we've got that's allowing us to respond and going, okay, this little community over here actually has got a really low rate because they've got no transport. So let's go and deal with them in situ. And, you know, I know a lot of our Indigenous communities, not in Victoria, but in the other parts of the country, are getting that kind of treatment, and rightly so, in that sense of things. Brenda, is it pretty fair to say that we're now at a very similar level to what vaccines would normally be in the community in that context? You know, like normal vaccination, so are normally pretty much in the low to mid 90s, I think, and we're around that number.
Yeah, I think both the Pyrenees and the Central Goldfield Shire are well into the 90s, like high 90s now, and as a whole, as being vaccinated. So that's really good for our herd immunity. So I think everyone needs a big pat on the back for that.
Yeah. And probably the other
Rendell might be able to back this up or disagree with me, whichever way she chooses to go here. But a pharmacist friend of mine in Victor Harbour, where I came from, 2020 was his lowest sales of cough syrup, lozenges, everything else. Because with the pandemic, for the first time in years, everybody went out and got a flu vaccine. And the flu for 2020 was like the smallest it's been in 20 years. And he hardly sold anything. And I don't know if you saw that same thing within your area or not, but yeah.
Yeah, very much so. There's probably a bit of a fear that people didn't want to go in for cold and flu tablets because they'd be perceived to have had COVID. So it might have been a bit of both.
Yeah, no, it's a really good point, Dave. My wife's on the board of a pharmacy group based in Ballarat, and that was just completely their lowest year all over in that context. So that's interesting. That's we all stayed away from each other. There's a bit of a message.
But flu vaccinations for the first time, flu vaccinations went, like 90+%.
Yeah. So a really important one for us to cover tonight is where in Pyrenees Shire or surrounding can we actually get vaccinated?
I hate to say this, but it's changing.
Yeah.
But that's because the bulk of the people are vaccinated, and it is changing as they consolidate the resources, because we can't maintain these mass clinics indefinitely. That's just not feasible. So the Grampians Public Health Unit is consolidating down to within Ballarat. The Mercure will not be operational in January. It's closing towards the end of December, that big mass centre. Ararat will continue on as a sub-hub, as will Horsham. Then there's the pharmacies. They're getting on board, and you see signs out the front, Moderna, Pfizer, come make your booking. So the pharmacists are going to keep this momentum going, as well as, I think now we've got a lot of the general practitioners all working on it. So whereas they were holding back and hard to get product and everything, now they're all pretty much any GP, any medical practice will be able to offer you a vaccination, and you book in, and it's all done orderly. So I think the message is the GPs, your local family practitioner, some clinics will still be operating, and the pharmacies, but also there will be school clinic specific. They haven't been planned because when are the 10-year-olds due? We don't have that. We'll probably learn that in January, and some groups will come out and work maybe within the schools. This is currently in planning at the moment. So I will continue doing what I do till December, and then pull back and just say staff, residents, and our staff's immediate communities, such as our volunteers, the Shire workers kind of fit into that with their Meals on Wheels and all that sort of home visits type stuff. And so we are still broadly working with our local community on those stakes. But it will look different in 2022, I can assure you, because I'm running out of people to vaccinate. Even though we're offering dose 3s and boosters, we're still working our way through. The majority of the staff at Beaufort and Skipton Health Service will all have had their dose 3 by the end of January. They'll all be done. Likewise, all the residents. And so we're scratching to find people to vaccinate right now.
I'm glad you mentioned the home visits, because one of the things I've seen both in regional Victoria and in regional South Australia and rural areas of both is that we're getting scattered groups of people who want to get vaccinated but haven't, because they haven't been able to get to a doctor or a vaccination hub or whatever, for a lot of reasons. No transport, too far, whole range of things. So I'm glad you mentioned that, because that's still to happen in a lot of areas.
And I think we're sort of at Maryborough District Health still trying to identify maybe groups of people that are having trouble to get to us, and how we can facilitate getting to them.
And that's both groups and spatially areas, both, isn't it, Rindell, in that context? Yeah. And just, Kristen, you mentioned
people home, we've gone and picked them up. Our volunteer drivers has helped, but most of them will link in with the GP at some point. So there's a contact person point there, but we know the people that we provide our services for, and so within our region. whether the district nurse is coming or they're getting some services or home help or something. So through that professional or that support person, they're kind of getting picked up, and we'll facilitate them as best we can.
Yeah. And we'll be really moving into a kind of a booster scenario kind of come
underway.
March, April. Well, as you say, we've started on that already in that sense. So as you say, that'll be through those local GPs and pharmacies and those types of things.
And all the healthcare workers, we don't need to worry about them. They'll all be done within their own organisations, generally covered. They're almost, well, I'm a dose 3 person. I was in early March. April was my dose 2. So in October, I'm actually 6 months out from my dose 2. So 2 weeks ago, I had my dose 3, my booster. And some of our immune compromised individuals, people with known severe medical conditions, the autoimmune, people on chemo and what have you between their cycles, these people have been getting their dose 3s at between 2 and 4 months. So some of them are getting a booster, which is almost like a dose 4. So it's sad that we're worried about our dose 1s and 2 kids, but the rest of the adults are sweeping through and already getting boosted up because we're going into our festive season. Yay. Families, great. Food sharing, great. It's all coming together. People are travelling now and they think it's all over, and their behaviour is reflective of that. So those who are eligible to be boosted, it's recommended to do so because of the time of year. But the advantage is you can go and sit out in the garden with Nana, and the kids can come and visit outside in the open space because we're in summer. I'm glad we're going into summer at this time, and a majority of our people are done. And a lot of the kids will start happening through January before they start school, I would imagine. But there's an unknown, and it's hard to give a journey where it's unknown because we want to give our kids the facts and this is what's happening. It's unfolding. Life is like that. And I think that's the lesson that they're taking on board.
That's a great note, Christina. Now, I think we're probably getting towards the end. So I'm really keen to run around the panel. If you've got any last final things you'd like to say, pop on the live stream.
I guess that there's a couple of things. First of all, I think we have to recognise our frontline vaccine people because they've done such an awesome job. By the middle of next year, they would have made themselves unemployed because they really have done an awesome job. And I think we need to recognise that. And I think we also need to recognise groups like the Pyrenees Shire Council for doing stuff like this, because we've got this on YouTube. People can use it all over the place now within the Shire, the council parameters and that, or anywhere. And this is what Amy and Eliza and myself are all about, is to get this information out there. Not that Amy and Eliza have been hiding. Come back to the screen, girls.
I'm here, David. You're doing a good job on your own.
Just when you thought you were flying solo, David, it's not the case. Yeah.
Thank you.
Never flying solo, David. I've got these two behind me all the way.
You haven't even needed us tonight. You're all good. You're all good.
Yeah. Did you, either of you, Eliza or Amy, have anything you wanted to contribute at this stage, given we're getting close to winding up?
Eliza, did you? I guess I'm part of the program because I am passionate about the vaccination program, and I love my job, and I love working with people like David, who are our beautiful community champions, and really looking out for the positive health outcomes in the community. I just encourage anyone really to seek guidance from a GP if they do have questions, and just know that the resources are available if they need them. And yeah. But David, you've done a good job.
Oh, but, you know, what they're not saying back here is they give me this script, you see, and they give me these, and I scuttle it every time on them. They give me this whole thing, and we'll do this, and I blow it out of the water every time. They don't tell you that.
You add your own flair to it. We love it. That's what the community needs.
No, thank you to the three of you. to my panel members in the room?
Actually, I'd just like to add on to that. Like we're so fortunate tonight to have all these people and professionals that have come and spoken to us. And I think everything we've said tonight, again, just to reiterate that we are totally blessed to live in a time that we have this information at our fingertips. I would have hated to live years ago and see my children have to go through, a severe illness and then not to be able to help them. And I think I'm really hopeful that, with the information we've got out there and having over half a dozen kids, to be able to protect all of them is just such a wonderful thing as a parent. And as a community member to see, I just said this before, but it's just so hopeful how we're all supporting each other and trying to get that information out there, send people in the right direction, pick people up in cars to be able to allow them to get to these sort of facilities. And I just think it's just wonderful. And I just wanted to, that was more a comment, but I'm really thankful for what's out there. And again, to thank all those health workers who have worked tirelessly over this time as well to support people. And mental health workers, as David, that's your area of expertise. That's just so important. So thanks.
Thanks,
my last word.
You know what the sad thing is about that? Is that David and I, after this pandemic, David and I will never, as mental health people, will never be able to retire. We're going to be employed till we drop.
Yeah.
I think it's probably a good thing for parents to know it's okay to have questions. And it's really good to ask questions. It's important to know that you're looking at the right spot to find your answers. So whether that's like a health professional, GP, pharmacist, immuniser, or even on the internet, like just make sure you're looking at, reliable resources. But it is perfectly normal and okay to have questions.
Yeah, thanks, Renda.
And I think I'd like to share the fact that we all, as parents, we all have these concerns, even if we've already had our children vaccinated and other parents haven't, that we are having the same thought processes that they are, and that it's okay. And you might be scared and worried, but listen to the stories of the other parents who have had their children vaccinated and share that. Have a conversation back and forth and share that information. And I'm just hoping that this sort of forum and sharing this on the live and also having it on YouTube as well, that parents who haven't yet encourage their children to get vaccinated will actually watch it and maybe go, oh, wow, they were also worried about the same things that we were. So, and
it is a hell of a responsibility. It is someone else's life, we put ourselves at risk, we can do that, but someone else is different. But as you say, Rendell, there is any amount of good professional advice there, and everyone will have a family GP. That's a great place to start.
And it's the same theme questions, like everyone, like the questions that come through are all the same thing. So you're not alone. There's plenty of other people that have exactly the same question.
And I'd maybe just reiterate what David said. We're booking summer camps for kids at the moment, which are great because I think kids have missed out on so much outdoor time with peers in the last couple of years. So that's been fantastic. But one of the questions we're getting over and over again is my kids will be mixing with kids who aren't vaccinated. My kids are vaccinated, other kids will be on camp who aren't, or vice versa, and what's our stance on that? And at the moment, we're just saying to them, look, we're going along with what the Department of Education advise. There are mixed cohorts at school and we can't ask you to be vaccinated. We're strongly encouraging people to be, and we as a business are putting in place lots of COVID safe measures to try and mitigate the risks associated with that, and really just being supportive. And so whilst we're giving out those messages constantly, I'm still asking the questions in my head about, can we ask parents to vaccinate their kids? Is it a safe environment? So it's an evolving situation, and it's a really confusing situation sometimes for both us as operators and as parents. I don't know if anyone has any thoughts on that, but our kids are all mixing at school and in community sport and all sorts of things at the moment, and there is mixed vaccination status there, and there will be for some time. So, I don't know if anyone else has got any thoughts on that.
It does. It just reflects current reality, doesn't it? Your summer camp really isn't any different to, as you say, your son going down to the depot. It just reflects current reality. Yeah, but it's just I'm actually not there as a parent right beside you. That's the difference. Yeah. It
does. I think it's okay to say we don't know everything, but when we know more, we'll tell you. When this is available, we'll tell you. Well, it's current. You get to know, and you get to know quickly. And it's okay to say, I don't know. I don't know what February 2022 looks like, but right here, right now, this is what we can do. And you can have being vaccinated in your toolkit. You can have that knowledge. You know, if you're in a big crowd, you can put your mask on, whether you're vaccinated or not. You have some extra tools to help you to keep you safe. And put it in context. We are still in, although it doesn't feel like it, a pandemic. And we still need to put the context. Vaccination's a big thing and it's wonderful, but keep it real, people. We're doing this to protect ourselves against what's out there. And I've stopped saying if to people. If you come in contact with someone who's COVID, and they won't know yet because they won't have developed it, it's when. It's right now. It's when this happens. Right, yesterday I was wearing my mask in the supermarket and I am vaccinated and I know that. You're going to feel so much better because when you get told about this after the fact, you'll know what you have done to protect yourself. It's context. It really is context about what we're trying to achieve here. And there's so much infection control literacy out there now. People know so much about, you know, infection rates and inoculation periods, all sorts of things like that. And young people are really savvy on this. They've got all sorts of tools that we didn't as kids think about. Culturally, it's changed. It'll be okay for me to walk around with a mask on, whereas you go back a year, come from overseas, or they must be having chemo or something. Or I think the way we behave has changed, and that's not going to be undone anytime soon. You'll see this stuff, and that is the new way of doing business. Just as
and I think that's a really good point. I mean, it's been a huge, apart from the public, it's been a huge learning curve for health professionals in general. And I'm going to beat the nursing drum here and say, you know, we've gone to PPEs and a whole lot of stuff, and stuff we've been talking about for decades. They've suddenly gone, maybe the nurses had this right. Why didn't we do it earlier? Because when we had the flu epidemic of 2019, we didn't get any of this coverage. And so I think we've kind of moved into a different health network professional system that, well, touch wood, we don't go back from.
No one soldiers on anymore. No one comes to work if they're sick.
No.
You actually let the team down if you come to work when you're sick. Yeah. Our whole way of doing things has been solidly reinforced with that's not how we can continue on, people. Yeah. If you're sick, don't go to school.
In fact, the soldier on ad, and I forget which lozenge that's for or whatever, have changed the fine print, and it now says underneath soldier on at home.
Yeah.
So it's even had an effect. Before it was soldier on, take this, but now it says soldier on at home. Yeah. So that's a really change to the whole dynamics.
But all in this together is holding true. We are all in this together.
Yeah. Yeah. And I'd just like to thank you for having me here tonight. It's been a real pleasure.
Well, I'd certainly, on behalf of the community of Pyrenees, like to thank all of our presenters tonight. Thank you to you, Eliza and Amy, as well, in that sense of things. David, it's just magnificent that you've been able to come to us only virtually this time, but let's get a chance to get you here in reality at some stage would be fantastic in the future. Really appreciate that. The things particularly that just a couple of ones that really stick for me, the bit about having the conversation, the bit about being the example is really, really important. And that's just a life thing in that sense. The fact that there really is support and there's any amount of good support there to help us out. But I think the thing that sticks with me most is, aren't our teenagers pretty grounded and pretty good people?
Yes,
I think that's the reality. They've approached this in a pretty pragmatic way in that sense of things. And I think that gives us a fair bit of assurance as parents in that sense of things. So please don't forget, this information is available. It'll be on YouTube. So certainly if you've missed it tonight, you can certainly go back and do it. There's any amount of, opportunity to get further answers in the community, whether it is your local pharmacy, the health service, your local GP, in those type of things. And I'd like to particularly, through you, Amy and Eliza, thank the department for their support for us doing this in Pyrenees. It's been true to be able to do it. And to you again, David, thanks very much for helping us make it a great night, and the same to our panel members. So thank you very much, everybody.
And if you want more info from me or Amy or Eliza, then contact them and they'll send it to me.
All right. And on that note, I think the final person I do need to thank that you can't see down here is Kate. And Kate's actually done the live streaming bit, so we can do the talking. Talking's cheap and talking's easy for us as councillors particularly. But the person that gets us to air is Kate, and that's really important. So, Kate, thank you very much to you and the tech people at Pyrenees for helping put this on.
Thanks, Kate.
Yeah. Thanks, everybody, and have a great night.
See you, Amy. See you, Eliza.
Bye.
Talk soon.
See you, David.
Bye.